Alzheimer's disease is a progressive brain disorder that affects memory, thinking, and behavior. It's a disease that indiscriminately unravels the precious moments of our lives. Meet Josephine, a loving grandmother and once a vibrant soul. She now faces the relentless grip of Alzheimer's disease, her memory slipping away like grains of sand through fragile fingers.
It started with simple forgetfulness, misplaced keys, and the names of cherished friends. But as the days turned to years, my world became a puzzle missing essential pieces. It's a cruel game, one I never wanted to play.
Alzheimer's doesn't just affect individuals, its reach extends to every corner of society. It's an emotional storm that family members like Josephine's granddaughter must weather. Watching grandma slip away, piece by piece, is like losing a part of our family history. The pain is immeasurable. Alzheimer's is not just a disease, it's a thief of time, memories, and the very essence of one's being.
What is Alzheimer's disease? Alzheimer's disease is a progressive neurodegenerative disorder that mainly affects the brain. It leads to a gradual decline in cognitive function, memory, and ability to complete the simplest tasks. Alzheimer's disease is a leading cause of dementia among older adults around the world. Its pathogenesis is characterized primarily by the accumulations of amyloid beta peptides and neurofibrillary tangles, leading to the loss of synapses and neurons. Nearly 30 million elderly people around the globe are affected by Alzheimer's disease. This number is expected to quadruple by the year 2050 due to the high aging population. The failure of current treatment. Alzheimer's disease is effectively incurable currently due to the lack of availability of medications that have a significant impact on the severity and progression of the disease. Some factors include current treatments are primarily symptomatic. They only address the symptoms but not the underlying cause of the disease. The treatments could have side effects, for example, gastrointestinal issues, sleep disturbance, and change in behavior. And they are typically prescribed at a late stage of the disease when significant brain damage has already occurred.
Currently, more than 55 million people suffer from dementia worldwide, and it is estimated to increase by nearly 10 million new cases yearly. Alzheimer's disease is the most common form of dementia that contributes to 60 to 70% of the cases. The prevalence of Alzheimer's disease rises with age. The incidence of Alzheimer's disease in individuals from 65 to 74 years old is 3%. Those from 75 to 84 years old is 19%, and those above 84 years old have a 47% incidence. In 2022, it was estimated that around 8.5% of older adults, or roughly 260,000 people in Malaysia, were living with dementia.
The symptoms of Alzheimer's disease can vary from person to person, but they generally worsen over time. First, memory loss, forgetting recent events or conversations, misplacing items, and struggling to remember names or faces. Second, language problems, difficulty finding the right words to express themselves, struggling to follow conversations or repeat themselves. Third, impaired judgment, difficulty making decisions or solving problems, struggling with tasks that require planning or organization. Fourth, changes in mood and behavior, experiencing depression, anxiety, or agitation, becoming withdrawn or losing interest in activities that one enjoy. Fifth, difficulty with everyday tasks, struggling with everyday tasks such as dressing themselves, bathing, or preparing meals. It is important to note that these symptoms can also be caused by other conditions, so it's important to consult with a healthcare professional for an accurate diagnosis. While there is no cure for Alzheimer's disease, there are treatments and lifestyle changes that can help manage its symptoms.
Being a progressive disease, there is no doubt that Alzheimer's impact is devastating on those who suffer from it. Patients experience worsening memory loss to the point they can no longer recall or even recognize basic details such as their name or even their own family. Continuous brain damage in severe Alzheimer's can cause hallucinations and paranoia, even rendering patients completely dependent on caregivers for the most basic tasks. In the near end of life stages, patients become mute and left bedridden. To be an Alzheimer's patient's caregiver is no easy feat. With over 90% of caregivers being family members or relatives, the constant worry over their patients' needs can lead to estranged relationships, physical isolation, and lone soldier syndrome, which is a sense that they have to bear the full burden of taking care of their loved one. Caregivers are also exposed to high levels of stress, be it work, financial, or patient-related, which manifest in the form of anxiety, sleep deprivation, depression, and other health problems. Overall, this leads to a poor quality of life over long-term care.
The diagnostic process for Alzheimer's disease is divided into 4 parts: detect, assess or differentiate, diagnosis, and treat. First detections involve the retrieval of information from trusted family or caregiver to provide more objective understanding of the daily routine, mood, and behavior of patient and changes over time. Second, the assess or differentiate step involve physical examination and blood analysis. Blood tests are performed to rule out potentially treatable illnesses caused by cognitive impairment. Laboratory tests, such as brain imaging tests, rule out hemorrhages, brain tumors, or strokes. Cognitive, functional, and behavioral assessment assess different aspects of disease to confirm diagnosis. For example, the mini-mental state examination or Montreal cognitive assessment identify the presence and severities of cognitive impairment in patients before referring them to a dementia specialist. Behavioral assessments are performed to identify behavioral and psychiatric symptoms caused by neurodegenerative diseases such as Alzheimer's disease rather than by alternative causes such as a mood disorder. Examples of behavioral assessments include geriatric depression scale, which is a questionnaire that assesses mood, and neuropsychiatric inventory questionnaire, which is completed by knowledgeable informant or caregiver to report a patient's neuropsychiatric symptoms. Third, diagnosis is performed through lumbar puncture to analyze cerebrospinal fluid or of suspected dementia patients. This determines the level of A-beta 42 and p-tau or t-tau proteins, which are proteins associated with Alzheimer's.
While there's currently no cure for Alzheimer's disease, the initiation of appropriate treatments and interventions help to manage symptoms, improve the patient's quality of life, and provide support for both the patient and their loved ones. Main medicines are acetylcholinesterase inhibitors, which increase levels of acetylcholine, a substance in the brain that helps nerve cells communicate with each other. Examples include donepezil, galantamine, and rivastigmine, which are prescribed for patients with early to mid-stage Alzheimer's disease. Memantine is used for Alzheimer's patients with moderate or severe Alzheimer's disease who cannot tolerate acetylcholinesterase inhibitors, or for patients with severe Alzheimer's to take on top of acetylcholinesterase inhibitor. Non-pharmacological interventions. This attempts to positively influence cognition, mood, and other behavioral and psychological symptoms of dementia, like reminiscence therapy, validation therapy, reality orientation, and cognitive simulation therapy.
OTC medications that can manage Alzheimer's disease can be ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory drug that can reduce inflammation reactions that cut off blood supplies to brain cells, slow the formation of amyloid plaque deposits, and keep brain cells healthier longer in people with Alzheimer's. And the most widely known brand name is Advil. Ibuprofen comes in various forms such as tablets, capsules, and liquids. The recommended dose is 1 or 2 200 mg tablets every 4 to 6 hours, with a daily maximum of 800 mg to 1200 mg. It is important to follow dosage instructions on the label or as prescribed by your healthcare provider. Ibuprofen can be taken orally with water or food, preferably with a meal to reduce the risk of stomach upset. While it can be taken at any time, consistency in timing ensures a steady medication level in your body. Some side effects of ibuprofen are stomach upset, confusion, and fall. Caregivers should be aware that people with Alzheimer's may have difficulty taking medications by mouth, so they may need to ask their doctor or pharmacist if the medications comes in liquid form or in tablets that dissolve. Additionally, caregivers should use the lowest dose possible and watch for side effects such as confusion and falls. Also allow the medications a few weeks to take effect.
Which of the following is the leading cause of dementia in the world? A. Alzheimer's, B. Vascular dementia, C. Lewy body dementia, D. Frontotemporal dementia. Which of the following is one of the main medications for Alzheimer's? A. Panadol, B. Donepezil, C. Memantine, D. Amoxicillin. Caregivers of Alzheimer's disease are at a high risk of the following, except A. Depression, B. Anxiety, C. Sleep problems, D. Improved mood.